Hi, I'm Antonio Mora. Lies, damn lies, and statistics. We now have dueling protests from those who want the economy reopened, let's call them the openers, and those who want to stay shut down, let's call them the closers. And both sides are desperately spinning statistics to support their positions. It's disappointing that we have to even talk about two sides, that they are entrenched in an increasingly acrimonious fight, and that you have to question everything you hear, especially the numbers that people are selling as the gospel. Let's start with the debate over how deadly COVID-19 is. Both sides have their points. The openers argue that the fatality rate is no more or even less than that of the flu, and say it's crazy to commit economic suicide with what we know so far. They will tell you that we are undercounting cases, highlighting studies in New York, LA, Miami, and California's Santa Clara County that showed far more people have been infected with the coronavirus than the official numbers. That would mean a much lower than advertised death rate. To further bolster that argument, the openers cite a study of state prison systems in Arkansas, North Carolina, Ohio, and Virginia. It found 96% of almost 3,300 inmates who tested positive had no symptoms. On the other hand, closers will argue that all those studies are faulty. They prefer to focus on numbers that indicate a much higher percentage of those diagnosed with COVID-19 end up dying than those diagnosed with the flu, and how in every country so far, the rate of deaths to confirmed cases has been far higher than that of the flu. They'll also argue that we have undercounted COVID-19 deaths, pointing to new federal data that indicates significantly more people have died in the U.S. this year than the increase attributable to confirmed COVID-19 deaths. The bottom line is that neither side has the data to come up with anything close to a definitive death rate for COVID-19. But we do have clear data neither side can contest. Even with unprecedented social distancing, COVID-19 has killed 60,000 Americans in 2 months, something the flu has never done. Without measures to flatten the curve, who knows how many people would have died, and whether healthcare systems outside densely populated urban centers would have been overwhelmed as well. However, now that the curve has flattened, closers are insisting on keeping shutdowns in place until testing is expanded dramatically and many contact tracers are hired and ready to go. While that may be important in New York City, Detroit, and Chicago, does it make any sense to wait for that in Wyoming, where 7 people have died, about 1 in 85,000, or Utah, where 46 have died out of 3 million? Openers are almost surely right that staying shut down there and in large parts of the U.S. will cause more suffering, even deaths, than opening up. But openers are far less convincing when they spin other numbers, minimizing the threat of COVID-19 to people who aren't senior citizens. Sure, the overwhelming number of hospitalizations and deaths have involved older patients with underlying conditions. A JAMA study found that in the Northwell Health System hospitals, which have housed the most patients in the country throughout the pandemic, 94% of patients had at least one comorbidity, which means they had at least one disease other than COVID-19. That would seem to support the openers, right? Protect the vulnerable and open the economy with everybody else. Not so fast. Why? About 255 million adults live in the U.S. today. 100 million of them have high blood pressure. 121 million have cardiovascular disease. More than 100 million have diabetes or prediabetes. More than 70 million are obese, and 37 million have chronic lung disease. Of course, many of those overlap in people with multiple conditions, but a very large number of people in their prime working years have comorbidities. 52% of men 55 to 64 have high blood pressure. 37.7% of those 35 to 44 do. 42.8% of adults 40 to 59 are obese. 35.7% of those 20 to 39. The National Health Council estimates that 157 million Americans have at least one incurable chronic disease. A Kaiser Family Foundation study found that 45% of Americans under 65 are at higher risk, but it didn't take into consideration all the underlying conditions mentioned as problematic by the CDC. So there is no question that COVID-19 poses a serious risk for a majority of Americans who aren't old or obviously infirm. However, it is worth noting that among confirmed cases, only 7.4% of patients 50 to 64 end up in the hospital, and only 2.5% of those between 18 and 49 do. And those percentages would be much lower if we had an accurate count of all cases, including people who were asymptomatic. One final point. Both openers and closers need to be aware that one size does not fit all geographically. As this map shows, some states, the ones in blue, have a greater percentage of adults with a higher risk of serious illness from COVID-19. Most openers do not want to move forward recklessly in a way that will lead to many more deaths. Most closers do not want to destroy the economy and increase suffering. We can reopen carefully in a way that avoids a resurgence and that protects the most vulnerable. But spinning statistics won't get us there.